Well, let's go ahead and get started. Greetings and welcome. I am so pleased that you are joining us over the lunch hour, if you're in the Central Standard Time Zone, for our Reimagining Public Health Careers, Expand Your Career Horizon Alumni Career Panel. And that's from wherever you call home. My name is Heather Weinreich. I am an alum. I'm also one of the alumni board members and also a member of the mentoring committee. And I'm going to be today's moderator for our career panel, and I'm joined by the wonderful Christopher Schmidt, if you would like to wave. He is a current executive public health administration policy and administration student. And Christopher will be monitoring the chat today for any and all of your questions for our panelists. Before you signed on today, I was telling the panel that I'm absolutely thrilled to be co-moderating this event. My feeling is that many of us enter degree programs because we were exposed to a certain degree or a certain career, so we assumed, well, we have to get that degree to become whoever we want it to be. But degrees, especially one like the MPH, it opens doors to pathways you may have not even considered. So that is the goal today, is for you to see what your career or your degree can do and what careers it can open up for you. Today, you're going to be hearing from 4 alumni who took unconventional career paths with their public health degree. And we're going to welcome any questions at any time through our panel discussion. So please type in your questions either by clicking on the chat or the Q&A button on your screen, and we'll get to as many questions as possible. I know that a few of you also had submitted questions, and after we kind of go through some of the standard questions we have for our alumni, we'll get to those next. Also, after the panel today, you will receive a follow-up email with a link to a brief online evaluation. Please take the moment to complete this, as your feedback will help shape future programming events. And thank you again, Vance, for taking the survey. And now let's get into it. I am so pleased to introduce our 4 panelists today. We have Jason Kuntz, if you would love to wave, Tasha Ray, Dr. Bruce Ravasanga Mandela, Omaira Santiago Rivera, and you can call upon her. And each of these individuals, we can address them by their first names. All of these proud graduates are from the School of Public Health. And so panelists, for the first kind of go around, if you could please share your pronouns, your program, your graduation year, and then a brief overview of your current work and the career path you took after you graduated from the School of Public Health. And Bruce, would you like to start?
Sure. Thanks, Heather, for having me today. And I'm really excited to talk to a couple of my former classmates and the current students. He graduated from the MPH PHA program in 2014 and from the MHA program in 2015. Currently, I work with Optum Consulting, and it's government federal and state agencies consulting 101. So lots of proposal development as well as model project ideation and implementation from beginning to end. And I'll turn it back to you, Heather.
Jason, you're next on my list.
All right. Thanks, Heather. Jason Kuntz, good to be here. Graduated 2013, which is wild to think it was that long ago. Focus was industrial hygiene. And I did the whole kind of professional work and then professional school at the same time. So I was at 3M at the time, working as a corporate industrial hygienist. From there, I actually transitioned over to sales at 3M. And it was a technical sales. It was selling personal protective equipment, which for the first time in human history, I think everybody understands what PPE is, which is good and bad, I suppose, depending how you look at it. And then now what I've done is I've transitioned back to corporate safety at a global perspective within the 3M company. So that's my journey. And I'm currently stationed downtown Minneapolis, so probably not far from many of you. Again, super happy to be here today.
Fantastic. Tasha.
Hi guys, I'm Tasha, happy to be here. My pronouns are she and hers. I graduated in 2018 with the Community Health Promotion Program. I'm currently a social scientist at FDA in the Center for Drug Evaluation and Research on a team that kind of serves as an internal consultant for evaluation to the center.
And Myra.
Hi, everyone. Thanks for having me. So I graduated with MPH in Public Health Informatics. We were kind of the unicorn program because there were only about 5 of us at the time. So that was super exciting. I worked at MDH specifically with the immunization registry for the state. I did some work at a health information technology company as a consultant. For a while before returning back to Philly, which is my hometown. During my journey, I always felt myself enjoying the business operations or the business development side of things. And so when I came across my current role with New York Life, I found myself in a unique position to essentially leverage everything that I've done in the past and create actually have a more direct or indirect impact on health with the people that I'm working with now. So I'm not working in public health anymore, but I see it as more financial health. If I can help people reduce their stress in the future, or even currently, if I'm given the opportunity, I think that's quite meaningful to me. And so that's how I found my new career path.
Excellent. Just before we go on to the questions, there is one from Nia. What is the role of an industrial hygienist before we move on, Jason? Can you explain that to the group?
Yeah, I'll be super brief. So it's basically to anticipate, recognize, evaluate, and control workplace hazards around specifically usually chemical exposure and then noise exposures as well. So industrial hygienists at this time have been some of the more, I'll say their calendars have been full over the last 12 months because they've been at the front lines understanding what the impacts are potentially within the workplace of COVID-19 and making sure that their workers are safe. So high level industrial hygienist, IH.
Fantastic. All right. Our first question is, what experience best prepared you for the career or position you have and why? And Tasha, let's start with you.
Sure. So I actually realized that I didn't really give any context of my career path in my introduction. I, after graduating, worked at the Department of Transportation for about 2.5 years. And I would say my best, what experience best prepared me was really everything kind of built upon each other. And I took something from each of the experiences and kind of transitioned just a little bit from each thing. So I discovered public health while I was in undergrad and evaluation specifically while I was in undergrad. And really while I was in that experience, I was interested in the topic portion of it. It was an obesity related program. And then during my program, I worked for Minnesota Department of Health and was on an evaluation team there and discovered I really, really liked it. But I really wanted to transition into more injury, more mental health type work. So that kind of fit into traffic safety. And then from there, I'm still doing injury related work now, like safety work for drugs that are already on the market and looking at programs to help drugs be regulated. So I think it was really taking the one thing that kind of fit to take the next step.
Excellent. And Bruce, what experience brought you to your career?
Yeah, it's really hard to pick one experience that brought me to my career or position. And one of the things I really love about my current position is that the diversity of experiences that one can get on different projects. On the work that I do, typically it's either proposal development and management or executing on a project. And typically one is staffed as a subject matter expert, or you are part of the senior leadership team, so you'll be staffed as a project manager or leader on the project. So an example would be of how diverse it is. Right now, I don't know if a few of you saw this, but the former CMMI director, Brandon Smith, wrote a really critical piece of CMMI projects in the New England Journal of Medicine that was essentially saying that the center, CMMI, hasn't seen the returns in the over $20 billion that have been invested in the 54 projects, and that on many of these projects they've lost lots of money as a result. And when such a piece came out, the immediate thing we all had to start doing was to do project evaluation of each and every CMMI project we are working on. And that was the moment when I was like, Bruce, why didn't you attend that project evaluation class in grad school? Because I'm like right now literally looking everywhere to see how I can learn as much project evaluation as I can. And that's a little bit tells you about the diversity of the work. On another project, I'm the clinical lead for a hospital outpatient quality reporting project. And my role as the clinical lead is to look at existing literature and see if any of the 6 outpatient imaging measures in place make sense for the current, based on the technology that keeps coming up every year, still makes sense, or if we need to reevaluate them and have CMS change them as they impact lots of the prospective payments that practices receive. But yeah, that's it's lots of different areas of expertise, and as a result, lots of experiences inform the work that I would do on them.
And Myra, you kind of alluded to a little bit with your background in finance, but what experiences prepared you for your position?
So if you would have asked me years ago in undergrad if I ever thought myself going into finance, I would have been probably said no. But honestly, I always knew that I wanted to be helping people. I always knew that health was a priority, and it's something that I always wanted to pursue. But I think that one of the major things that I've learned in undergrad, as well as my program at the U, is that health is holistic and it should be comprehensive. And it's not just about your physical, mental well-being, but I also believe that it's also your financial well-being, and how, your finances can really play a role in how healthy your life can live, and how stress can, indirectly affect that. So, like I said in the past, I used to work as a consultant at the health information technology company, and I used to do business plans. And so that's also far different from MPH, what I study is in informatics. But when I found myself, researching companies and crunching numbers, I knew that this was an interest of mine. I felt that, I felt it was quite interesting to keep learning and to keep trying new things. And so I knew that I wanted to continue having an impact on people's lives and living healthier lives. So the reason why I moved back to Philly and not stayed in Minneapolis was because of my family. And so my family and I were super close. I'm the only child. And so I knew that I wanted to be closer to them. So I came back. I almost quickly found New York life. And honestly, when, I was speaking to my current manager and he was explaining, what they do and how they help people, and how, the history of the company has been, impacting people's lives for so many years, I knew that this is something that I could see myself doing. I knew that it was going to be challenging. It was going to be totally new, but I knew that if I can leverage everything from the past, if I can see beyond, what I was currently looking at, focus on just, physical health and not financial health, I knew that I could get past it. And so I've been with them ever since.
No, I don't, you're right. They're so intertwined. And I think, I come from a medical side, and we do think that, everything is compartmentalized, but you can't promote health if you don't have a financial stability. So very interesting perspective. And Jason, what were your experiences? I know that you said you worked at 3M at the time you were going through, but anything in the past that helped prepare you for what you were doing now?
Yeah, for sure. So I took notes to keep me on track here. So there's 3 things. It was the 3M, kind of the professional and the academic experience at the same time. But I think I'm not a neuroscientist, but neuroscience would say that we are wired to be rewarded for doing hard things, for doing tough things, for challenging ourselves. And for those of you that are doing both at the same time, you understand what I'm saying. In the experience, in the personal growth and development and learning that happens through that, That's unquestionable. So that was one thing. Second thing is a lot of mentoring and coaching from others. But then actually on my first day of, it was orientation on my first day of school in the industrial hygiene program at the U, I was introduced to a program called Boulder Options, Minneapolis-based mentoring program. And I got deeply involved in that program thanks to the University of Minnesota. And I've now got to mentor a young Black man in North Minneapolis for the last 8 years. And so the level of perspective that has brought me to understand what it's like being a young, he was 12 at the time, now he's 18, just graduated high school. But what it's truly like, single mother, North Minneapolis, him and I have, we come from different places, and to be able to see that perspective of how tough things have been for him, and then to be able to come alongside him and help him out through that has provided invaluable perspective. And then the third one would be, and I know this probably can't be done by everybody, but my friends and I actually started a nonprofit 2 years before my time at the U. And that nonprofit has grown incredibly. So it would just be time in the space of volunteering for some local charity or nonprofit, just to kind of round out our skill sets and again, broaden our perspective. So those three things, right, is the 3M experience, it was the mentoring, and then it was the volunteering in the community. Those were the three big ones.
Great. And Heidi gives you a shout out for, she used to be the advancement director at Boulder Options, so she's giving you a shout out there. So
Awesome.
thank you.
Awesome.
So, this kind of goes along a little bit with, the experiences, but for any of you, and I'll leave this one open to any of the panel, did you explore different career options when you were determining your final career? And we talked about this, was it a straight shot, or did you do the meandering pathway and try a little of something? And then the tag team question to that is, when did you figure out a path worked or did not work while you were doing this? And what did you do about that? I hope that makes sense. Does anyone want to take that, or I'll call on you again?
Heather, I can get us started. I think like the best thing I can say about this question is a book recommendation. And it's one of those few books that you read. I read it last year, and my biggest regret was, why didn't I read this as an undergraduate student when I was starting out? And it's a book by someone called Clayton Christensen. He passed away recently, and it's called How Will You Measure Your Life? Clayton Christensen, How Will You Measure Your Life? And he really talks well about having an intentional endpoint, as well as not losing sight of what you're doing day to day and the opportunities that come up, and lots of other great insights in that book. And in a way, it talks to the question that Heather raised today. If you had asked me 10 years ago where I would be, I would have said not in the US, not doing the job I'm doing right now, and lots of no's to the things that I'm doing. But along the way, there are lots of things that happen that end up getting you to that point. A little bit about what shaped my career options. My career, like I mentioned, was one of those least well-planned ones. I wish I'd had more structure going into them. But all of it was in service of something. So as a young doctor, I was really frustrated by losing patients to having no blood or having no medical supplies. And what triggered in my mind was, there must be someone who can help fix this. We have, I attended one of the best medical schools in Africa and knew some of the smartest doctors. But when we ended up in the same system that we ended up in, the outcomes were always not as great as they could have been. And that is what got me on this path of, how do you fix healthcare? What are the lessons you need to learn? And I came to the US thinking US had figured it all out. And now that I'm in the midst of it, I'm learning that there's always the next level for whatever work you do. And just one small thing is that my experience up to this point in time is collecting experiences and expertise in different areas, which is why I've worked in hospitals, worked in government consulting, done some research, some departments of health here and there. And to me, that is all in service of, at one point, being able to go back home and help improve the quality, the delivery of healthcare there in the entrepreneurial realm.
Fantastic. Anybody else want to chime in about their career path? Tasha?
Yeah, I can. So another shout out to mentorship in general. I had a really, really great mentor when I was at the Department of Transportation. I guess I had kind of a unique opportunity. I was in a fellowship, so I had a little more flexibility than some of the other employees in the office in terms of picking out my own projects and picking skills I wanted to work on. So one thing she suggested to me was really just looking at job listings and picking out skills that I thought were interesting. And she was amazing in that I would tell her, I think I want to try this thing. And the next day she would have some opportunity that she just like threw me into. But it was awesome. I got to try different skill sets. And then to answer your question of like how I knew something wasn't a good fit, I mean, at some point I really didn't want to be in transportation. I just wasn't feeling like I was getting, I wasn't feeling like I was making a difference. And that was really what did it for me. I didn't feel like the work that I was doing and the projects that we were pushing forward were going to truly make a difference. It felt like we were doing things that have been done a million times. And that also kind of, for a while, turned me off of the idea of working for the federal government. So that obviously shifted, but I'm no longer in a program development type role either. So the evaluation role, I don't know, I've just always really enjoyed it. I like to joke that I get to tell people what they're doing wrong for a career. So I don't know, it's just like that moment of like what makes you happy and what makes you enjoy your day at work, even though there's days that you don't want to be there anyway, you know, that kind of thing.
Right. And it's okay, right?
Yeah.
It's okay not to, if you just did this, you don't have to do this the rest of your life. You can
Yeah.
change careers. So, great.
Yeah.
Myra, any thoughts? Or Jason, any thoughts?
Actually, I just want to piggyback. I would say totally leverage your mentors, leverage your professors, leverage people in your network who make a difference. I know that benefiting from the School of Public Health alumni group, I met a wonderful mentor who I work with at, Minnesota Department of Health. She's phenomenal. We're still friends to this day. We don't talk as regularly as before, but when we do, it's like we never skip the beat. So I would say definitely leverage those around you who you look up to, or even if it's someone new, ask someone in your network, hey, do you know such and such person that you can connect me to? This is what I'm interested in. So you can, pursue your dreams. And honestly, one thing is that, if that didn't work out for me, I would say I would agree with Tasha. If it doesn't feel right, I'm always the type of person that if I don't feel right in a certain situation or my heart's not really in it, not because I don't want to do the work, but because maybe it just feels like it's just not my calling. Maybe that's not the right way to look at it, but I'm more of a feeling type person. And so I've always tried to follow my instinct, even if that led me to a different path. So I would say do what feels right.
Jason, any thoughts?
Yeah, I'll just preface it with none of these ideas are mine. They came from much smarter people, but they've worked for me. So I'll say first, this is I meandered. Industrial hygiene first, very technical, hyper technical, brilliant people. Wasn't a fit for me. I'm more people focused. Industrial hygienists tend to be more task focused. So it's like, well, how can I combine technical with kind of people focus and passion? And so I said, well, let's do sales, technical sales. And I loved it. But then I noticed my technical skill set was getting a little dull. So then I made the transition now back to this kind of global safety and health role where I get to bring both back together, technical, kind of prowess and sharpening, and then this deep focus on people. And the way I got there is I asked a few questions, again, not from me, from some coaches and mentors, but get really clear on what do you want? Well, I wanted to travel, I wanted to work with people, and I wanted to be able to develop my technical skill set. Well, what do you absolutely not want? Well, I don't want to work for someone who doesn't put a focus on people first and who doesn't promote your growth and development. I'm out if that's the case. I want nothing to do with that. So ask, what do you want? Ask what you don't want. And then tell as many people as you can what you want to do. As many people, put it on LinkedIn, right? Broadcast it from the mountaintops, whatever. Someone's going to go because people want to help. They're going to go, hey, I got some, Myra, I got something for you. Bruce, Tasha, hey, this is an opportunity. So tell as many people as you can, not from a place of like boasting, but from a place of awareness and people want to help. Then finally, two more things, actually. There's this thing called the hedgehog concept, Jim Collins book, Good to Great. 3 things. This is fantastic. Okay. So if you can bring these 3 things together, like 3 circles, whatever that would be called, right? That's kind of what Jim Collins would say. That's kind of your mission in a way. So what are you deeply passionate about? Okay. What do you have the DNA and genetic coding to be one of the best in the world at? And then number 3, what fuels your economic engine? Because if you have the first 2 and you're not making any money, well, that's going to be tough, right? So what fuels your economic engine and what you need to live the life financially? Maybe talk to Myra about that, right? What you need to get by and get through. And then finally, who's your avatar? Who's doing what you already want to do? Success leaves clues. Jump, mentor, shadow, call them, get on their calendar, and just understand what they did to get to where they're at. So those few things. Again, not my ideas, from people much smarter than me, but I hope it helps.
Well, that's fantastic. That actually kind of transitions into, I'm going to jump a little bit to a question that one of our participants submitted, which is, what are the top 3 criteria for choosing a specific career path? And you kind of touch upon that, Jason. Anybody else want to chime in what their top 3 criteria were for choosing a career path? Bruce?
I think it's Heather, let me know if I'm answering this well, but I think it really ties into what Jason mentioned, which is like, what's the end goal? Deep down inside of us, like at some point in time, could be in your childhood, could have been in grad school, high school, or wherever, there's a certain problem or issue that sticks out so much to you, and you ask yourself, how can I contribute to fixing this? And I think like starting out with knowing what the end point is, like if you're in your, and forgive me for being a bit morbid, but the day you're in your coffin and you're in your grave, what are the sort of speeches you want people to say about you? Or like, what would you want your kids or grandkids or people who love you and know you well to say about what you achieved with your life on earth? And like, that's what I would encourage everyone to think of. And it's one thing that has helped me a lot. Like, what is the end goal? One metaphor kind of related to this, like one of my mentors shared that kind of really alludes it really well, is like your intellect, your experiences and time are essentially like a ladder. And like a ladder, it's what matters most is not the ladder itself, but where you place it. If you place it on the wrong wall, you'll get to the very top of that wall, but you'll be disappointed because that wasn't where you wanted to end up. So think of all the resources you have as your ladder and make sure that you find the right wall to stick them to. And that wall essentially would be like your end goal. And like said Jason really well said this, like along the way, you'll find like the process is easier than the destination to some extent, because there's the way magically things begin to place you in the sort of direction that gets you to that point you want to get to. But earlier on, identifying what that place is will allow you to stay true to it as you meander to that endpoint.
I think that's great advice, to have that thought that you need. I think a lot of us, especially when I was a student, was you just put the ladder up and I just got to keep going. And then you're right. Some of us get to the end of that ladder and we're like, I don't want to be here. So to really think about as a student where you want to go and to take those, whatever values you want in your career. Myra, Tasha, do you have any thoughts of like 3 things that are, you know, when you look at a job as you guys, because both of you have switched a little bit, where you had to have, or reasons you changed?
Yeah, I would say one thing to definitely look for is know what pace of work you need. Like if you need something that's fast paced, changing a lot, multiple projects, then you look into things that are more consulting or like teams where you're going to be working on multiple projects versus something where you're doing the same thing every day, all day. And luckily, not everyone has the same preferences, and there's jobs out there for both. And then also, I think, I don't know, for me, like what is going to satisfy you in terms of the content that you're working on. Like it doesn't have to be perfect. It doesn't have to be an exact match to what you want to be doing, but I think it does have to be at least something that gives you the satisfaction that you're doing something that's worthwhile, kind of to Bruce's point of like what you want people to talk about when you're gone.
A little soul searching that you have to do of values. Myra, anything to contribute?
I think they've all hit it right on the nail. But certainly just finding something that feels meaningful. And then certainly, I don't know, just piggybacking on what everyone has said, you know, finding something that you really want to do, write it all down, write all the things that are negotiable and non-negotiables, and then find opportunities that fit that criteria, right? And not settle. Don't settle. You should not have to settle. You should do what you want to do, and you should go after it, even if it's not a conventional path. And it may sound like a little cliche, but just go after it. Sometimes what you want to do can be done in different ways, and it could be done in other ways. The same thing you want to do, and just, you know, leverage your experiences, the people around you, and just go for it.
Absolutely. You know, and again, I've got a couple more questions that were submitted, but please, for the attendees, if you have any questions, submit into the chat and we'll get through them. A couple of questions that came through for the registration was regarding jobs. And I know there's some definite attendees on here that are looking for jobs, and it's kind of a twofold question, because one is, what are your top 3 recommendations involving job seeking? And then Tasha, you specifically looked for a job during the pandemic, correct? Yes, so it adds a little bit of a dynamic. So any thoughts about going for a job, what to look for in a job, or how to present yourself, but also what were the added challenges during the pandemic and how do you get over that?
Have a lot of patience. I will say my current position, I applied for a year before I started. Like the whole process took a year. And when I left my fellowship, I had been applying for jobs from my work computer at that point, because I was like, well, I'm in a fellowship, it's fine. I had 75 versions of my resume that I deleted. So apply for everything that you think you might be interested in. You can always do the interview. You can always say, no, this isn't a good fit after you meet with them, but meeting with them sometimes really, really helps make that decision. And don't assume that you have to apply a certain way. I actually applied for my federal position through LinkedIn, which is not normal. And I literally just clicked the easy apply button. I don't think I even submitted a cover letter because I was just like over it that day. But it worked out. I met with the team. I love my team. I submitted tons and tons of other applications with great cover letters. But, you know, just if you think you might have a shot and it's something you might be interested in, apply for it. And then like virtual interviews, it's a thing of the pandemic, but it's also a thing a lot of people have done otherwise. Just, I don't know. I feel like we're all kind of used to being on video at this point, but just imagine you're talking with someone that is across the table from you, and I don't know, do your best to do that. I did a lot of like following other people's lead in terms of like whether I was turning my video on or, because yeah, I had a couple of interviews that were like through a video platform and no one turned their video on. Afterwards, I would have said like, no, I probably should have turned my video on and made them feel awkward for not. What else in terms of job searching during COVID? I think still leveraging, reaching out to people who have a job that's the type of job you think you might want. They can connect you. It's always easier if you have some other connection. Yeah, it's different, but it's not as different as I think I would have expected. But I do think hiring is slower. So patience is key.
Good point. I mean, a number of you have also said this too. You've talked about mentors, different ways to get to a job. I mean, that's the other part, right? Is networking. Would you all agree to use your network, ask people? A lot of times jobs, especially for these career paths that you've taken, they're not posted. And also you've created some of your own, right? So any other thoughts about job searching? Or again, when you don't want to be conventional, or you're the only, I know a few of you are like the only public health person, you know, what do you do? How do you do that when in a job interview, or how do you pitch that?
Yeah. So Heather, if it's okay, I'll riff on this for a little bit here.
Oh, that's great.
Because yeah, we just made a few hires at 3M. So you asked for 3 recommendations. I'll say LinkedIn, LinkedIn, LinkedIn. Okay, 3 times. And Tasha just referenced it. You don't have to have an amazing, beautiful LinkedIn profile, but a professional headshot and then a few minutes on kind of who you are, right? And the value you can bring to an organization. Not all of my credentials and why I'm the greatest in the world, but this is the value I bring to people in organizations if they were to hire me. That should be your headline. So professional headshot and then what you bring to organizations on LinkedIn. The other piece is this virtual space, this isn't going anywhere. Whether it's 3 to 5, 7, 10 years down the road, like we're still going to be doing this. So investing in a $100 webcam, right? Investing in some really like $50 to $100 lights or so, you'll have them for like the next 10 years. It's worth the investment. Trust me, right? No question about that. So how do you show up in the virtual space and what does your kind of home office look like? Doesn't need a huge investment, but some minor tweaks can make a big, big, big difference. And then the other piece, and this was referenced, Heather just pointed to it. Everybody is available right now. In the last 8 months, I've had 130 30-minute mentoring interviews and counting. Guess how many people have said no? 0. 130 yeses, 0 no's. And most of these people have no idea who I am. They're thought leaders in the safety and health profession. I said, hey, can I interview you? I want to learn about you and how you got to where you're at. Who's going to say no to that? Nobody. Again, not my idea. Someone told me to do it and I'm like, let's do it. I ran with it. You can get on anybody's calendar right now, but you have to reach out. No one's going to reach out to you. So just a few things. I hope that helps.
Fantastic. Any other thoughts?
Yeah.
Bruce.
Yeah, if I could piggyback of Tasha and Jason, there is, I remember this time really vividly, which is that time before graduation, and particularly for an international student, the stakes were slightly higher because you either get the job or you're kicked out of the country before you want to leave. And I remember how stressful it was and the nightmares that came with it. But if there's anything I would share about it is that it's a concept I learned from United Health Group Culture Values, but it's something called gravity issues. And the gravity issues essentially is things that are outside your locum of influence and control. Essentially, like all of us are held down by gravity. Like if it wasn't gravity, it would literally fly. But none of us can walk around saying, oh man, gravity really held me down today. It is what it is. The job market might not be what you wanted it to be when you're graduating. The jobs that you're looking for might not be exactly what you're looking for. but all those are gravity issues. You have little or no control over influence of them, but there are things you do have control and influence over, and some of those Jason has really eloquently addressed them, as well as Tasha. I'll kind of say a little bit about the methods that worked for me. And those three methods were: one, applying blindly; two, networking to a job; as well as the third one being headhunted. Those were the three ways I've gotten the three jobs I've had. The first one, the blindly applying, and the same thing that happened to Tasha is the same thing that happened to me. My current job was an easy apply LinkedIn application. And those are the ones where, like, they yield the least return. You're going to put thousands of them, and probably one or two will work, but they are the easiest to do. The one advice I would have on blindly applying is most organizations which have over 500 employees have HR departments, and if your application doesn't spell out that you've either had that job or have done things that are similar to what that job is looking for, it won't even get before the hiring manager. So at a minimum, you have to make sure that your application matches whatever is being asked in that job, so it gets to the hiring manager. And once you get to the hiring manager, and from my experience on that side of the table, hiring managers, and this could be just me, but are really lazy. We're not, like, when you're hiring someone, you're looking for someone who will do the job at a minimum, because you don't want to hire someone where you're going to not only do your job, but do theirs. And the stuff about, like, being from an Ivy League or having the highest GPA is awesome stuff if you have it, but at the end of the day, it's not what will determine if you get the job or not. It's, can you do the job if you arrive on day one or not? The second one, the networking to a job, same thing. Jason really said that well. Like, I've never had a no. I send lots of weird emails to lots of like people I'm interested in networking with, and I would say like 5% of them have not had a response, and I still follow up. But 90% of the time you hear back, and some of them they'll connect you to that job. And it's one of my previous jobs was through, like, jabbering someone that I was a fellow student with, was like in a VP role, and they helped me get me into the organization. The last one is the being headhunted, which is the best position you want to be in. And I was fortunate enough as a VP who, like, saw my resume. I don't know even up to date how he did, but he saw it, called me, and I was like, hey, there's a job for you. And it worked out well. And for people who are in such a position where you have options, the one advice I have for you is, when you're picking between the jobs, pick the team you're going to be working with. Because there are certain departments in certain organizations where, like, people go to essentially do the least work or get to retire essentially, and won't help you rise as fast as you would like. So look, find out who you're working with, if it's impactful work, if you have several options, because at the end of the day, those people, more than the work itself, are the ones who help you get that velocity to your career. Sorry for a mouthful, but yeah.
No, right. I mean, right. And networking seems to be critical, right? Using all the resources that you have available, finding out who you're going to work with in all of this. And then in the comments, Jason put in, I'm always reminded of Elle Woods, right, from Legally Blonde, right, with she perfumes. But again, using somebody, a family member even, or a friend, to really make your resume stick out and to look ultimately professional. And then sell yourself. There's a great book too called The Art of Bragging, right? How to toot your own horn, but yeah, to really sell yourself almost as a business plan. What do you bring to an organization? And Tasha said that, meet the team. She was nodding a lot on that one as well. The last question I'm gonna pose to you before we open up, we got a couple of questions in the chat. Do you know anybody with an MPH that's in politics, or how do you get involved in international work? Kind of the two of, how do our attendees kind of figure out if they want to go into these other realms, and if you know of anybody that has done that, especially the election one.
I don't know anybody, but please do. I would love to see some MPH representation in that space, and I'll leave it at that.
Anybody else?
No, I don't unfortunately know anyone with an MPH in politics per se. Maybe in undergrad. I think I know maybe one in politics, but but certainly it'd be great to see a fellow MPHer up there for sure.
Bruce, any thoughts, or Tasha?
Yeah, not really. I was just trying to think if there's anyone I know, but I don't know anyone who has successfully
Somebody that's
gone that
on
route
this
yet.
call needs to go. And you're right, absolutely. It's a degree that it would be well served in politics and that understanding of what public health is, right? It's not just working for a Department of Health, right? It's, like Myra, you said, that aspect of finances. So fantastic. Christopher, do you want to bring up any of the questions that we got? I think they were through the chat.
Yes, so we've got one question. Well, we've got several questions, but the first one that I'll ask is, how did you discover what you want when you still might be early in your career? I'll leave it at that and let y'all pick from it.
You might not. Like, you pick one thing that you think you want to try, and there's time. Like, it doesn't have to be the first job. Like, your first job can be like that first pancake you throw out. I think someone said that to me once. I don't think I came up with that off the top of my head.
A fantastic analogy.
I love that. I'll share something that made a big impact for me. Well, one of my favorite speakers, he's a big Southern preacher, about 6'8", 350 pounds, big man, T.D. Jakes. And his son came home from one of his first ever jobs, and he was absolutely defeated. And they were sitting at the dinner table, and the son said to his dad, he said, "Dad, I don't think this is for me, and I don't think I'm ever going to figure out what I'm supposed to do on this planet, right, vocationally." And his dad looked at his son, and he said, "Well, son, know this. If this thing isn't the thing that eventually is the thing, this is the thing that will lead to the thing. And you're never going to get to the thing without going through the things that aren't the things." And it was something like that. And I'm like, none of it is ever wasted, ever. Whether you're throwing pancakes out, waffles out, whatever it is, right? Changing garbage cans, it doesn't matter. It will set you up somehow to get to where you need to get to. And you'll never get to where you need to get to unless you go through the things that aren't what your current thing actually is. So I hope that helps. That helped me. And when I was like, what am I going to do?
Fantastic. Thank you all. As a side, to backtrack real quick, are those two things the same? An MPH from the U of M who is in politics is the mayor of Richfield, Maria Regan Gonzalez. Hey, fantastic woman, great person. Does anybody else want to interject on this question?
Sure, yeah, I can say something really, and it's kind of essentially building off what Jason and Tasha said. It's very unlikely that straight out of school you'll get the perfect job that you've always dreamt of, or that was the reason you went to graduate school. That one thing that you'll surely get is a job. And once you get that job, like just learning that, like being as good at it as possible and learning all there is that it can offer is probably the best way of spending time instead of thinking and waiting for the awesome opportunity. And one really funny thing that I've experienced is in that, like, I hate this job. Sometimes that's where the magic happens. Like two of my jobs I've had were like one where there was so much politics that at one point I was like, let's say working on my resignation letter, and someone was like, hey, okay, could we just talk through it? And I know we don't have time, but I could share more details on it. But it was one of those things where you're like, I'm done with this. And someone just talks to you about an alternative way of thinking about it, and you try those things. Let me share a little bit about it, because it will help be less vague. And this ties into like being authentic. So one of my previous jobs that I was hired at, one of those positions where you're like visible enough that when you're failing, it is so obvious for everyone to see. And I was failing, and in my mind I was failing because everyone around me was failing me. through taking away some of the portions of the work I liked and things like that. And 6 months in, it wasn't getting any better. It was getting worse. They were taking more responsibilities away from the job that at the end of the day, what I was doing was something like super elementary work that wasn't interesting at all. And I met with a VP who had hired me, and essentially she was like, Bruce, you're one of the most exciting hires I've ever made in my career, but right now you're not doing enough. What is the problem? And I was prepared because I knew I was failing. I told her how everyone was failing me, how the work was hard to understand, being an outsider was coming into something that lies upon on culture and like norms on how things are done. And she kept probing and probing and probing and probing. And 2 hours in, I finally said what it was. I was like, every single day I'm coming into work, I have to create a work persona because there's the way that everyone wants me to behave, and I've been trying to preemptively behave that way, and I think that's what is failing me. And she said one statement that changed everything, which was, when we hired you, we knew you were a non-traditional candidate, and we expected that you would behave and do things differently. And we took that bet on you, so do what you need to do. And that is what happened. The next day I set up, like in 2 weeks time, I set up all these meetings, had conversations with folks where some tears were shared by some people of like, hey, you're doing this and it's not helping me. Hey, you took this away from me, I need to be doing that, or you're doing this way, I think the client needs this done differently. But like shedding that work persona and showing up as myself and facing the challenges head on, instead of the pretense that everything is okay or trying to be what I'm not, was what really changed the perception. That is all to come back to. It might suck, but if you like go through it, you might on the other end get to what you're hoping it was.
And that kind of echoes, there's a couple of comments, if you want to look in the chat, both from Jason and also I think from Tasha, right? And Tasha's comment saying, if you don't, your job isn't it, tell people, just kind of what you said, Bruce, is be verbal about, because if you're a valuable employee and you've got skills, you don't have to be stuck there, that you can figure out what you want to do and find a team that works for you. That's great advice, everybody. Christopher, any other questions? Right, there was a right on.
We've got another question that deals with the opposite of finding your dream job, and that is, how do you handle rejection from interviews from a job you think you're meant to be in? How do you deal with that?
So rejection sucks. No matter how you spin it, there's no question. When I was trying to get into sales at 3M, the system kicked me out 5 times. Because I didn't have 3 to 5 years of relative sales experience. And so I got rejected 5 times by an automated bot, right? By a system that wasn't a human being at all. And then eventually, obviously, they got me through the barriers, but rejection sucks. The 2 questions I think that I've found valuable to ask are, what does this mean? And then what do I do with it? So no doesn't mean you're rejected. A no may mean not yet, or a no might mean this wasn't the right fit for you. It could mean all kinds of things. It's up to us to decide the narrative that we're painting around what no means. So first question, what does this mean? And I would encourage you to frame it in a way that's very positive. Wasn't meant to be, this wasn't the right fit, so on and so forth. Second piece, what do I do with it? Well, it's up to you what you do with it. I can't give you advice or guidance, but if you can answer those 2 questions and do so and frame it in a positive manner of, this isn't the right opportunity and I'm empowered to do something with it and move forward, I think you're in a beautiful place where it won't feel so much like rejection, but more of like an opportunity.
I have a couple of things I would add to that. One, know that it's not always you. Like I think a couple of us said, there's job listings that get over 500 applications. Like, might just be timing of when you submitted it and they came across an equally qualified person first. Another thing is, if you have the opportunity, if you're in some sort of situation where you can ask for feedback on your interview, do that. And also when you do that, know that you don't have to take all of the feedback. it might just be their preference, but they could say something really, really helpful.
Sure. Thank you.
Myra, do you want to?
I was just gonna add two. Maybe one thing that helped me too with a lot of rejection was looking at the job description, and then if I was if I was rejected from that particular job, maybe just re-looking over the skill sets, seeing if there's anything that I can improve upon in the meantime. So that way, when I reapply again for the same position, now I have that skill set. Just wanted to add that.
Thank you. Thank you, Myra. One of the comments that we've got in our chat is learn to experiment, try new things. Don't be afraid to fail at any of your positions. You can always try something else. But the key from that chat was boldness is essential when looking for a career. I think we're coming right up to our time. What's next, Heather?
So we do, it looks like one last one popped up. Jason, are you able to share a bit about how you got through your barriers for 3M for marketing? It's a 3M role. If you do a quick response, and then whatever, we'll just have one last piece of thought from each of the applicants, and then we'll close it on out.
Yeah, I'll answer that in 7 seconds. I knew the regional sales manager that was hiring, and I hounded him, and he got it done. So that was it.
Perseverance.
Yeah, well said.
All right. Any last minute thoughts from our panel? And I, again, want to thank you. No, Christopher?
So if you're comfortable, panelists, can you share your email in the chat with our attendees? We don't want to email them out from the School of Public Health. We don't want to email them out for privacy reasons, but we really appreciate it.
Mm-hmm. Heather, any final comments from you? We had a nice little chat ahead of time, and you had a lot of wisdom to share. So I would love if you had something to say to kind of bring this all together.
I really think, the take home points, for us being on the other side, right after getting our degree, and then recognizing your degree is not just, again, the career that you saw that made you even seek out the degree. I think it really is recognizing mentors, not finding, but recognizing when somebody is mentoring you, leveraging people. And I'll be very candid, as a female, I don't think we do this as often. But, I think every one of these panelists have said that. Talk to people, use these people, use our group as mentorship, whatever we can do. A lot of people want to help students. They want to help you get a job. If you're a good candidate, people are going to hire you. If you find out you're in that job and you don't like it, it is completely okay to get out of that job if you're not happy. But I think how each of the panelists said is I love that, Bruce, find your ladder and the wall that you want to climb. And even if you think that was the wall and you get to it, it's okay to come back down and find another wall. So I out of the bottom of my heart, I want to sincerely thank all of you for taking your time, attendees. I want to thank you as well. And Christopher, any closing thoughts you've got as we have our last minute here?
So I would also like to echo the thank you to all of our panelists for your insight today. This program for our attendees, this program was set up by the University of Minnesota School of Public Health Alumni Society as a resource for you to get a better understanding that there are a lot of different options with your public health degree from this school. Not only that, but so I encourage you to consider thinking outside of the box as you go forward in your career paths. But not only that, the School of Public Health has a student senate. That's a board that I'm a member of, School of Public Health Student Senate. Does a great job of connecting students and with mentors, really with opportunities to think about your career after school, after you're finished with the degree. And I open an invitation to every person, every attendee who is a student in our school to become a part of that program as well, the Student Senate. So thank you all for attending.